A new survey-based study from Elevant Health, a large healthcare insurance provider, suggested 94% of patients were satisfied with virtual primary care visits from their physicians, and nearly 80% agreed that those virtual visits with their physicians allowed them to have better control of their health. And that's a big deal. So considering that, and very similar data, a question begs to be asked. Is virtual primary care a thing of the future, or is it already here? Now that was just a summary, but the details matter, so stick around. Hey, I'm James Santolo. I'm a registered nurse and a health researcher. I bring to healthcare workers like doctors, physicians, assistants, nurse practitioners, and registered nurses health information and trending medical news that matters. Anyways, let's talk about this new data recently released by Elevant Health. As a quick review, I already told you around 94% of those surveyed were satisfied with their virtual primary care visits, while nearly 80% felt those visits allowed them to be more in control of their health. So this was an online survey-based study by Harris Poll, and the responses were based on a total of 5,000 US adults aged 18 or older. So why is this relevant? Well, first, the age of technology is here, right? And if you don't hop on that bandwagon, you'll likely be left in the dust, as nearly everything is transferring to a more digital market, right? Not at least beginning to make a transition could translate to substantial monetary loss and even reduced quality of care to your patients. That's because technology gives patients easier and quicker ways to interact with the healthcare system and facilitates speedy transmission of information. And as all of you know, time is money. Also, remember, the COVID-19 pandemic greatly altered the way patients interacted with their healthcare teams. For example, look at this image from this Harris Poll survey. The top bar indicates 84% of patients generally agree that virtual primary care was useful during the pandemic, but that they would continue to utilize virtual primary care even as pandemic conditions improved. That's a very interesting figure. So think about that for a minute. Now, let's check out the second bar here. 83% of people generally believe virtual primary care was a great way to increase access to healthcare for those who might not be able to visit their providers in person. I don't think I have to tell anyone watching this video, as the population ages in the US, people tend to become sicker and sicker. There's substantially more chronic disease now than there was 50 years ago, and that chronic disease can make it very difficult, if not near impossible, for people to make it to in-person primary care visits. Think of how many lost appointments there are for just that reason alone. Anyways, it's quite clear this and other data suggests the same message. Virtual primary care isn't the future, it's right now.